Welcome back to Close Up. We've been talking this morning with freshman Senator Maggie Hassan about the atmosphere in Washington and these days, what type of actions Congress is taking as President Trump moves ahead with his agenda. But Senator Hassan's also been very busy talking about the opioid crisis of addiction here in New Hampshire. You co-sponsored a STOP Act with Senator Rob Portman, among others, Marco Rubio, which kind of impacts the U.S. mail. A lot of the fentanyl and the ingredients for fentanyl is coming through the U.S. mail from other countries.
Look, our heroin and fentanyl and opioid crisis remains our biggest public health and safety challenge here in New Hampshire and, of course, across the country as well. And one of the things that has really contributed to our death rate here in New Hampshire has been the use of fentanyl, which is a drug that is even far more lethal than heroin, coming to us often from China through our mail. So the STOP Act, which is a bipartisan bill, is aimed at making sure that we get electronic data in advance of the product coming through about who's sending the package and where it's going. This is really important to law enforcement as we try to keep this drug out of our country. We know that we have to address the supply side as well as the demand side here at home. And in the meantime, I'm also working with members of both parties, and it's an issue I raised during the confirmation process, in particular with Secretary Price, but also with Secretary Kelly, to get more resources to help us address the demand side. It's one of the issues that's also at stake as we have this debate about whether to repeal the Affordable Care Act. One of the things that I've been pointing out is that our bipartisan Medicaid expansion program, which is part of the Affordable Care Act, has really helped us expand treatment for addiction and for behavioral health here in New Hampshire. And if the Affordable Care Act is repealed without a replacement that provides this kind of coverage, both through Medicaid expansion and through the essential health benefits that's required under the Affordable Care Act, we will really regress in terms of the amount of treatment we can provide. I've been honored to be talking to people in New Hampshire who got coverage through Medicaid expansion, have been in recovery now for a year, are working, they now have private health insurance. So our Medicaid expansion plan has been one of the critical components to really helping us address the heroin and opioid crisis, and I'm very concerned, and it's one of the areas of focus I have in Washington, that as we have this healthcare debate, people understand what a difference the Affordable Care Act and Medicaid expansion have made to our ability to address this epidemic.
And enhancing treatment and getting rid of the drugs in general was a campaign promise from this president. It's difficult to say what it's going to look like with this replacement plan because no one has shown anything yet. Is there any sense of what people are talking about? Because the White House does assure, you know what, we're not just going to scrap anything without adequate replacement.
We really don't have a sense. We hear rumors a lot, but it seems that the Republican majority was in such a rush to repeal the Affordable Care Act that they really hadn't thought through what they were going to replace it with. And we will be looking to the president, who said he wasn't going to pull the rug out from under people, to really insist that if they are going to repeal the Affordable Care Act, they have a replacement plan and they're transparent about it so people can see what the choice before us is. We don't want to go back to a time before the Affordable Care Act where people with pre-existing conditions could be denied coverage. We know how important the Medicaid expansion program has been in terms of helping people get healthy and returning them to the workforce, for example. We know that there are improvements that need to be made in the Affordable Care Act, to be sure. We know we have to reduce costs, and one of the things that I talked about and want to continue to do and have actually taken some action on is allowing Medicare, for instance, to negotiate the price of prescription drugs, which would help us bring down the cost of pharmaceuticals, which is part of the issue in terms of rising costs in healthcare. But there was a reason, that the business community supported Medicaid expansion. We all know that we have to be able to provide healthcare coverage, especially preventive and primary care, to all of our people. And right now, with this focus on just repealing the Affordable Care Act, there really seems to be a chance that the Republicans will repeal without a meaningful, comprehensive replacement plan, and that's very concerning.
Now we'll see what happens to it moving forward. Affordable education, also something that you talked about as governor and on the campaign trail as senator, something you've been working on as well. What What does that look like so far?
Yeah, well, so I've had a really wonderful time in this state work week meeting with constituents all over the state. We had a roundtable at Keene State College to address the issue of student debt and what it has really meant to students in terms of what kind of choices they make about their education, what kind of choices their families make, and what kind of future they have. One of the people I talked with just the other day is through college. She and her husband have 2 children. They are in their late 30s. They won't be through paying their student debt until for 15 more years, which means from their viewpoint, they'll never try to buy a home. So this is a real issue that impacts our competitiveness and the quality of life of our people. One of the things I want to focus on is expanding the Pell Grant program. And I also want to focus on how we can help either defer student debt or forgive student debt for young people who want to be entrepreneurs in New Hampshire. We know how important small business is to this state. If we could defer payments and defer the accrual of interest for people who are engaged in starting a new company or working for such a company, I think that would be a real benefit to the economy here in New Hampshire and around the country.
We only have a couple minutes to go. I'm interested in knowing, I mean, obviously you've been in public service for a long time, 2-term governor, but with so much that you're working on, how do you compartmentalize, prioritize, and keep your focus on one thing and then immediately go to something else, whether it's Homeland Security or affordable education?
Well, you know, one of the great privileges I've had is serving the people of New Hampshire in both the state Senate and as governor, now United States Senator. So I am blessed to have a lot of really wonderful partners here in New Hampshire and in the nation's capital. We all work to stay up to speed together. We all work to bring together a lot of different perspectives about all of these issues. But at the end of the day, these are all issues that impact middle-class families. They impact our job-creating businesses. They impact our capacity to stay secure or to stay free. And so they're all interrelated. You know, when you think about what it is we want for our kids, I don't care whether you're a Republican or a Democrat or an independent, we all want our kids to have a better future than we have. We all tuck our kids in at night in the same way, and we wish the same things for them. And if you stay focused on the components that go to making healthy families, healthy communities, and a healthy democracy, and support job creation, then it all makes sense, and we can all move forward together to build a brighter future for our kids.
Well, it's been a busy couple of months. Best of luck to you moving forward. Thanks for coming by today.
Thank
it's great
you
to
very
see
much.
you.
Really great to be
Senator Maggie
here.
Hassan, indeed.
Thank you.